Hello, and thank you for joining us and listening about Vietnam Health Clinic and our organization today. I hope you find this information beneficial as you consider joining our team in our Mobile Health Clinic 2025, taking place here in July. My name is Mylin Nguyen. I am a pharmacist, and I'm one of the board members here at Vietnam Health Clinic. I will now pass it along to Brandon, our HP Relations Officer, who will share a little bit more about our organization.
All right, and hi there. My name is Brandon Trong, and I am the Health Relations Officer. And just a little bit about Vietnam Health Clinic. VHC is a 501(c)(3) nonprofit organization which is dedicated to improving healthcare access and services to under-resourced populations of Vietnam, in particular Da Nang, while promoting proactive learning and firsthand experience in primary care for our student members. And just a little bit about our history. So we were established in 2008 with Global Brigades Medical. And in 2009 was when we first took our trip back to Vietnam. And over the course of 15 years, we have constantly been developing our care and slowly expanding to our mobile clinic as it is today. And so this is our general organization structure. And we consist of a board of members, student officers, advisory committee, healthcare professionals, which is you guys, volunteers, student members, and professional students. And the board is there to provide consistency and continuity of information to care in our services throughout the years. And it is a majority student-led and board-driven. So all the day-to-day will be run by our student officers. So these are our board members. And we have 8 board members with different backgrounds that come together to help oversee all aspects of our organization's operations. And we have our SAD, which is our Student Affairs Director, which oversee the day-to-day tasks between our student officers and provide guidance on decisions that need to be made. And these are our student officers, which you'll be working closely with. And over to the next ones. Passing it to
Awesome.
Maya.
Before we kind of through what to expect as you consider joining our team, wanting to give some background about Vietnam and the current healthcare infrastructure. So it is a mixture, both public and private, meaning there is some form of universal healthcare coverage, and 70% of the Vietnamese community members are covered. Very limited in accessibility and what that coverage entails. And the government does subsidize for the poor, as well as the younger and older adults. So the current problems with this infrastructure is that there's just not enough access points, not enough hospital. There's definitely a strong shortage of primary care or doctors, as well as equipment to serve the community members, especially in areas that VHC is servicing, which is the rural areas, rural communities. Now, even primary care is already hard to access. You can't even imagine how it is for the specialty care services like vision, physical therapy, dental, prenatal services. And there's just not enough education on preventative measures and the management of their current medical, like chronic conditions. So, how do we here at Vietnam Health Clinic select our sites? We have gone to serve the North, the South, and have landed to kind of base here in central Vietnam due to the lack of access to hospital and clinic sites. There are other organizations with kind hearts that are serving the North and South Vietnam, especially the Mekong Delta. So we have decided to really focus our efforts and try to make a difference in central Vietnam. We have surveyed out and look at what are community members lacking. Public transportation, absolutely. If those who are uninsured, those are the people we want to serve. So after some surveys and kind of research, that we kind of identified these are kind of the core elements in consideration. So, if you are going to be traveling with us, we do home base out of Da Nang just because that is a huge port. Also, there's an international airport there to make it easy to fly in and out. And Brandon will be speaking a little bit more of that later, but we will all be busing out to Gai Nam Yang, which is where you can see the star there. That's going to, it's about an hour and a half up to 2 hour of a bus drive. We all hop on the bus or buses together as a team, and we head out there to provide our acute care and specialty care services. And I'll let Brandon talk a little bit more about there here.
And so this is just our itinerary for our mobile clinic. So the large group, which is composed of our student members, student officers, will depart from Seattle at 1:40 a.m. and arrive in Vietnam July 12th at 9 a.m. in Da Nang. And the following day, on the 13th, we'll have our HP meeting in the evening once everyone has settled in. Clinic days will be 2 days on and 1 day off for the HPs. And then during the first week, we'll also have a handoff meeting on the 19th after our reflection dinner. And then just like filling in the second week HPs, like any information that you found useful or tips that you might found on working on the clinic site. And then following our second week of clinic will be similar to that of the first week. So it'll be 2 days on, 1 day off. And on our last clinic day, we will also have a pediatric day. So it will just be peds for that day. And we'll be flying back on the 27th. And so for the roles that we are going to be recruiting for, will be nursing, medical, dental, optometry, pharmacy, public health, and physical therapy. And for the requirements, we do require that our healthcare professionals do 1 week minimum for our clinic participation, and the full duration of our clinic will be from July 11th to the 27th, with week one being flying in on July 13th to and then flying out on the 19th, and then week two will be July 19th flying in, and then the July 27th flying out. And then here's just like the typical daily schedule that we had from last year. So wake up calls roughly around like 5 to 6 a.m. And then around 6 a.m. is when we ideally like to all be boarded onto the bus and driving to the clinic site. And then from 8 a.m. to 12 p.m. Will be our first shift of our clinic. And then from roughly 12 to 1, we'll be taking lunch in shifts. So first half will be all of intake. We'll be taking lunch first, and then towards the end on that second half, then pharmacy and such will be taking the lunch break. And then after that, from 1 to 5, we'll do the second half of clinic. And then from 5 to 6, we'll break everything down, take it back all with us. And then we'll have dinner around 7 to 8. And then the student members and student officers will be med packing around 8 to 10 o'clock, and then just restocking everything that we do need. And okay, so this is our general clinic layout. So patients will be through intake, and our nurses will triage them, and they'll be dispersed just depending on their chief complaints all throughout, just so that there's not a huge bottleneck in one component. And patients will get to visit essentially every component. And afterwards, they'll be going to pharmacy, which they'll get any medication that they needed, and as well as their goodie bags after their visits. And I'll be going more in depth into each component later on. Here are just some of the pictures from each of the components. So intake, vitals, medical, opto, and dental. For the pharmacy, consulting, physical, and the public health. For the nursing station, so the roles will be just to acquire any health history that they do have, their chief complaints in triage, and then just assess any needs that they do have, just to either escalate a situation or not. And we'll be recruiting 3 nurses, and a student interpreter will be provided if you do need one. And nurses will also just be, overseeing and supervising students as they measure vitals for each patient. And for the medical component, so There will be one scribe and one translator if needed. If the student can do the translating as well, it'll just be the scribe and the translator. And so for this role, primary care providers will just assess any acute care that needs to be treated. And there will be a in-house drug formulary that will be released. And so any antibiotics that do need to be prescribed will be prescribed here. For the dental component. So dentists will provide any dental education and any dental treatments necessary for patients with any tooth pain, along with some restorative care. And so some of the equipment we do have for sterilization will be the autoclave and the bins for any cold sterilization. And we do have two portable generators to help power our PDU. And we are recruiting 3 dentists for this trip. So just some of the goals for our dental expansion initiative. So just reduce the number of extractions that we do have. Our main goal is just to help establish better dental hygiene so that there is less tooth decay. And if there are like local dental programs there, just establish partnerships with them so that we do have that sustainable care that we are reaching for. And as far as procurement of additional dental equipment, dental x-rays and additional portable dental units, and just any fillings for adult and children cavities, stainless steel crowns for pediatric dentistry, and dental deep cleaning and periodontal maintenance. The stainless steel crowns for pediatric dentistry will probably be something that we are really looking for, just because we do have that pediatric day. And so moving on to our optometry. So in optometry, we'll be providing comprehensive eye care or eye exams and screening for eligibility for those that do qualify for cataract surgery, which we launched in 2019 and picked it back up after COVID in 2023, where we have had a number of successful surgeries. And here we'll be recruiting for 2 optometrists and just going into a little bit more in depth about the cataract surgery. So patients that do qualify will receive a voucher and they'll come back the next day and we'll bus them out to Sanang Eye Hospital that we partnered with, and they'll receive their surgery there and then they'll be bused back the same day. And moving on to physical therapy, the majority of our patients are farm workers or do labor-intensive work. So it's important to help promote better physical mobility and overall physical health. And for physical therapy, we will be recruiting 2 physical therapists for this year. And for public health, as part of our goal of sustainable care, we'll be having students walking around while they're waiting in line for, let's say, medical or for opto or dental, just help urge patients to make healthier lifestyle choices such as smoking cessation or proper brushing techniques to better their dental hygiene. And yeah, that's how I'll pass off to Marlene for pharmacy.
Thanks, Brandon. I just wanted to note for public health, it is embedded in every single component, but the student member volunteers do have a great team that go around and engage with the patients who are waiting in the waiting rooms on some of those public health education material. All right, for pharmacy, because I'm the pharmacist, wanted to kind of share out what the role entails and that you will be working with me. I would note that it operates very similar to a community-based pharmacy, if you're familiar with that, meaning patients are going to come to the pharmacy component with their prescribed meds from all of the other clinicians, and we will be reviewing and dispensing the appropriate medications. So there's a lot of inventory and drug formulary management that as the pharmacist, you'll be assisting me with that need. And then the biggest proponent that we would like to emphasize and really focus on is the medication counseling. And this is because this is going to be the first, if not the very first few times patients may be exposed to or have been prescribed medication. So we want to make sure that they are using it correctly and taking it as prescribed, in its entirety. The neat thing about pharmacy is that we also partner with the University of Washington and Washington State University pharmacy schools. And so we will be taking on 4 advanced practice students, and they are in their 4th year. They will be assisting with all of the inventory and management pieces, but as the pharmacist, you will be acting as one of their primary preceptors and coaching them and mentoring them through this clinic and all of the I guess prep that is involved. Next item I wanted to highlight is the cost. There's always questions on how much will it cost for me to participate as a healthcare professional. So there's going to be kind of 2 main costs. First one is airfare. Depending on where you reside and how, when you depart and which airline you're going to take, average cost will be anywhere from the $1,300 to $1,600 at least as of right now. Of course, prices may vary and change as you get closer to the date of clinic, which is July 11th to the 27th. So just kind of keep that in mind. It's kind of peak in the summer months, so prices will be going up. Highly encouraged for you to look into that and budget appropriately. The other cost is going to be a trip deposit, and that's going to be directly to Vietnam Health Clinic. For the full 2-week participation, it's $2,000. If you're only going to be able to join us for 1 week, it's $1,000. Now, what that will cover is all of your in-country costs. So transportation to and from clinic. So how we highlighted, everyone hops on a bus and go out to our clinic site. They're typically like big Greyhound buses. So that is a cost. We will deduct that from your deposit. Food. The hotel that we will be staying at typically always provide breakfast. Lunch is going to be at clinic for those clinic days. For the non-clinic days will vary depending if you want to go on your own or we have an activity that like a group team activity, and so that will be an added cost into the trip deposit. Dinners will vary. Sometimes we do group dinners as a team bonding and just kind of a reflection after the end of clinic day. But there will also be opportunities where you can venture out in Da Nang to look for, the local street food or restaurants that are on that are highly reviewed and you want to check out. There will be some opportunities for that. And typically we do provide a stipend if for all of our members, student members, directors, everyone on the team get a stipend so that you can go out to venture and find your own kind of dinner plans. Hotel accommodations, we are still finalizing our final hotel at this time, and today is the end of January, just in case for those who are listening at later on. Um, the hotel will be our home base or central home base, and you will be staying there with the rest of the team for the full duration of your clinic participation. That cost is going to be included into your trip deposit. And then finally, we always offer travel insurance through our means, or if you have your own separate travel insurance when you're purchasing your airfare, that's perfectly fine too. And we will not be deducting that off of there. But if you are going to be using ours, we will deduct it from the trip deposit. One other thing I did not highlight on here or include on here is also malpractice insurance. I know that as clinicians in your own practices, or if you're with an employer, the employer have the malpractice insurance for you to practice here in the United States. There may not be international coverage, so we do have an option for you to purchase that, and that can be shared separately or as a follow-up. And if you do want to purchase that, again, it can be deducted from your trip deposit. The team, our finance team here, does a wonderful job in itemizing all of the costs and then looking at the total, that individual totals, and deduct that from your trip deposit. Anything that remains will be returned back to you. You have the option of donating it back to the organization, or we would just send you a check, or however you want to take back your the remaining of your trip deposit. But um, it will all be itemized and totaled out at the end. So on average, it costs anywhere from that 26 to 3,600, depending if you're doing the full 2 week participation or just to take back the remaining of your trip deposit. But it will all be itemized and totaled out at the end. So on average, it costs anywhere from that to 3,600, depending if you're doing the full 2 week participation or just a week with us.
So here are some common questions and considerations. So as far as vaccines, just ensuring that you get all your routine vaccines are up to date. And there are some travel vaccines that you are suggested to get. And so Mylin can help you answer which ones you will need prior to traveling to Vietnam. And we will all be staying at the same hotel and traveling together to Gai. And as far as SIM cards, we'll also be purchasing prepaid SIM cards in Vietnam to use. So make sure to let your phone provider know to unlock your phone prior to the trip. And then if you do have the same travel itinerary as us, we can connect you to our travel agent, Jenny, and she can help get you a potential group discount for your ticket. And moving on to Brandon.
This here I wanted to share out with all providers who plan to participate. Kind of going back to like the pharmacy component and wanting to let inform you as a participating clinician to know what is included on that drug formulary. Um, we look at all of the medications that we've used in years past and determine like frequency, the need, availability, and cost of those medications, and we share it out with you so that you are well informed and can let us know if there's anything that is either of concern or that there is a need. Um, so this is a roundtable discussion, very casual. It will be held virtually. Date to be announced once we gather a strong team together. And we look at, there's not only the primary care, but even each individual component. So dental, you have your handful of medications that we always review and make sure that we have on hand. Similarly, for our optometry clinicians with the eye drops, whether it's antibiotic or steroids, etc. Physical therapy with your pain medications or even like rubs, things that are of wraps. So supplies are included if we wanted to bring that up. And then for our pharmacy clinicians who are going to join, this is going to be a way for you to know ahead of time what to expect. We try to have a effective and efficient drug formulary, meaning that there's not going to be a lot of extra I guess onesie twosies. We try to keep it tight to allow that consistency and that allow for our patients to be able to access it if they need to replenish that at their own time or through the current Vietnam infrastructure. Um, so we look at, again, medication costs, availability, and procurement. We procure, I would say, 90% of our medications in Vietnam. There are some that we do purchase here, and there are ones that we do seek donation requests to. And so we will share more information about that at our drug formulary meeting. So just for you to be aware, it's going to be virtual, so everyone can participate and for you to be informed and know ahead of time what to expect and what is included so that you can serve your patients.
And so moving on to this is our HP commitment form. So you can go ahead and scan that QR code if you are interested and would like to participate in our clinic this year. Positions are filled on a rolling basis, and we will update the website as we are recruiting. And on. So thank you all for joining us today. And so if you have any questions or concerns, don't hesitate to reach out to my email right there or Mylin's email right there. And also do please be aware that many of our students may not have had the opportunity to gain an in-depth experience with certain components. We heavily value including students in our clinic for firsthand experience since it is student-led. And as such, we kindly ask for your patience and understanding, as some students may be experiencing their first time scribing with a family practitioner or even assisting chairside with a dentist during this clinic. And so, important upcoming events. So, our big benefit dinner, where we raise all the money that we do for our clinic, will be on April 12th, 2025, at Seattle Harbor, formerly known as China Harbor. And if you aren't able to make the event, and you would like to still donate, then if you scan that QR code right there, it will lead you to our websites.
Well, thank you again for listening in this info session. Again, don't hesitate to reach out to either one of us if you have additional questions or concerns. Once you do complete that HP commitment form, one of us will reach out to you for follow-up and hope to get to meet you to address any of your additional questions, and we can go through the further details. But thank you again. We look forward to seeing you join our mobile clinic 2025.